Hi, I'm Dr. Timothy Shin. Welcome to Heart, a video series created to provide important heart and vascular information to you throughout the month of February to celebrate American Heart Month. Today, our feature interview is with Dr. Zachary Virgin, a vascular surgeon here at Henry Ford Allegiance Vascular Health. Vascular surgeons have specialized in training to treat conditions affecting blood circulation, including blockages and clots, which have become especially problematic and prevalent during the COVID-19 pandemic. On February 24th, during our question and answer session, we will answer any questions we've received during our Heart to Heart video series. So please leave your questions in the comments section.
Thank you, Dr. Shin, for that great introduction. Hi, I am Teresa Dark from Marketing Communications, and as Dr. Shin stated today, I have with me Dr. Zachary Virgin. Welcome, Dr. Virgin.
Thank you for having me.
Will you please tell us a little bit about yourself?
Sure, my name is Zach Virgin. I grew up in South Florida. I met my wife down there. She's actually from here in town. And I did my training in the east coast of Michigan and vascular surgery down in Mississippi. And my wife brought me up here to do vascular surgery and have family.
Thank you. Mm-hmm. How does one tell if leg pain is serious?
It's kind of subjective. So what we worry about with leg pain in particular, a vascular surgeon in particular, would be blood clots in the veins or in the arteries potentially. What I worry about would be sudden onset of swelling in one leg, okay? One leg in particular, and a lot of pain associated with that. You may even see some changes in the color to the leg itself, okay? It might be real red, sometimes it can be white, sometimes it can be real bluish. But the important idea is sudden swelling, maybe some color changes, and some significant pain. Usually it's enough pain that somebody says, this isn't right, I'm gonna go see my doctor, I'm gonna go see somebody. So usually it's that voice in your head, your common sense saying, this isn't right. And that's usually the case.
Is an embolism the same as a blood clot?
When we say an embolism, that would be versus a thrombus or a thrombosis. Thrombus means a blood clot still where it developed. Usually blood clots that travel to the lungs originate in the legs. When they're still in the legs, we call it a DVT or deep vein thrombosis or a thrombus. If and when it travels, which they frequently can, they'll travel through the heart and they'll dislodge into the arteries that feed the lungs, the pulmonary artery that goes to the lungs. When that happens, you can have trouble breathing. A lot of things don't happen. You can have some potentially fatal consequences to that.
So who is most likely to be affected by a pulmonary embolism?
So folks that we worry about getting a pulmonary embolus would be somebody who's had blood clots before, whether it was in their legs or in their lungs. They're going to be at the highest risk. Other patients would be if somebody has a clot in their leg or a DVT in their leg, would be at high risk for developing one in their lung or one traveling to their lung. Also folks that have had major surgery, big belly surgery or otherwise, been in the hospital for a long period of time, some folks that have had major traumas, car wrecks and whatnot, and also certain types of cancers will make you more likely to develop blood clots potentially in the lung as well.
What are the warning signs of a pulmonary embolism?
Usually folks will complain of trouble breathing. They may say they can't walk up the stairs and they had no problems before that. They may say that their heart is racing. Sometimes they'll have chest pain, or frequently they'll have chest pain associated with it, and potentially even coughing up blood, okay? We do see quite a bit of blood clots both in the leg and the lungs from COVID. So certainly some COVID patients, many COVID patients, we will be concerned about blood clots, not only because of their symptoms, because they're related, but also because of the way the virus enters the cells and the fact that the arteries and veins in your lungs are in immediate approximation to where the virus enters the cells. They cause inflammation of the cells that make up those vessels, which will promote blood clots if nowhere else, as well as developing blood clots in the legs and whatnot too.
So how is a blood clot treated? And then my next question after that will be, how is a pulmonary embolism treated?
Mm-hmm. So they're, for the most part, treated very similar. Blood clot, no matter if it's in your leg or if it's in your chest, in your lungs, and we use blood thinners. They come in IV forms, they come in pill form. We use both. In the hospital, usually you're going to get the IV form. If you're at home or in the ER and it's safe enough to be discharged from the ER, a lot of the times we can give medications that are pill form. Okay, so they're similar in that both the leg clots and the lung clots will be treated with a blood thinner. More serious forms of these blood clots will require certain procedures. One such procedure is where we physically remove that blood clot from the lung. We usually poke the vein in your groin, and we use these long devices in our hybrid OR, and we use these long tubes that go into the heart and then into the lung, and we physically pull out those blood clots. It works really well. It is minimally invasive. That being said, we don't do it on everybody because it doesn't need to be done. We practice evidence-based medicine, and not everybody needs it. Most people are okay with a blood thinner, be it IV or oral. In only certain circumstances do they really need something more than that. But that is something we offer here.
Okay. So you talked about if they can be discharged and go home, and then they have the pill form blood thinners. So what would they do at home to stay healthy enough so that the blood clot doesn't break free, but also not do anything to break the blood clot free? What's the home care piece of that?
So the most important thing is, one, to be on the blood thinner, and two, to avoid doing things that would make you more likely to develop a blood clot. So one of the biggest risk factors is being sedentary, that is not moving around a lot. So a lot of sick patients in the hospital, they're not moving around a lot. And they are more likely to develop blood clots if for no other reason that they're not moving around a lot. So we tell folks, take your blood thinner, go about your life like normal. You're going to have some pain, you're going to have some swelling, and that will get better with time. Usually the swelling resolves with elevating your legs, things like that. But the important thing is to not just go home and baby it and sit in bed, not do anything, because you're actually going to hurt yourself in the long run.
So let's circle back to COVID. You mentioned COVID, and Dr. Shin in the introduction also said that the COVID pandemic has been problematic for blood clots. So can you go into more detail about that, please?
Yeah. So we are seeing many new cases of blood clots with folks that have really no other risk factors. Certainly we see a lot of sick people, and now we're seeing sick people that also have COVID. So they have multiple reasons for developing blood clots, be it in their lung or in their legs. So we are seeing many new cases, many more than we normally would, of blood clots. What we're seeing now that is new is we're seeing otherwise young, healthy people that don't have any chronic medical problems, and they may be college athletes, and they're getting blood clots in their legs, in their lungs, because of no other reason other than COVID. And that just has to do with the way the virus enters and invades the body. Okay.
So what can we do, the viewers and myself, to help mitigate getting blood clots and avoid them?
So one of the most important things is don't get COVID. So the best you can, get vaccinated, wear your mask, hygiene, whatnot, washing your hands. Apart from that, just regular old things. If you're having major surgery, it's just something to be aware of. Usually your surgeon will give you medications to reduce your risk. Other than that, minimize your risk factors. So folks with cancer are going to be at higher risk, so go for your mammograms, go for your colonoscopies, find treatable cancers before they're a problem, and hopefully avoid having these blood clots altogether.
Well, thank you very much, Dr. Virgin, for joining us today, and we really appreciate you taking time out to explain all these different things that are happening with COVID and without COVID on embolisms and blood clots. As a reminder, Dr. Shin talked about having a Q&A session on the 24th of February, so please put your comments and your questions into the Facebook post so that we can answer those on that day. Thanks again, Dr. Virgin.
Thank you for having me.